Hi, my name is Bailey. I'm going to be doing a newborn assessment on this baby girl. First thing I'm going to do when I walk into the patient's room or into the nursery is wash my hands using soap and water. And I am going to begin by checking the baby's armband for her name and date of birth and make sure it matches my computer. This is Ella Smith. The first thing that I want to start with is vital signs, and I'm first going to begin with her temperature. And I'm just going to check that under her arm. And the assessment finding that I'm looking to find is I want to find 97.5 to 99.0. And she's at 98.6, so that's completely normal. The next thing I want to assess for is her apical pulse. So what I'm looking for is 100 to 160 beats per minute. So I'm going to listen for a full minute to her heart. Once I've listened for a full minute, what I'm going to do is I am going to listen for a little bit longer to find listen for her heart tones, her heart sounds, and I want to make sure that they are in rhythm, they're in a good tone, and I want to make sure there's no sounds of murmurs, which could sound like a swishing sound. After I've done that, I want to check her breath sounds while she's already uncovered for the most part. And I want to do this right above the nipple line. And I also want to count for a full minute to check her respirations. And the respiration count should be between 30 and 60 respirations per minute. So I'm going to check above the nipples, and I want to check her mid-axillary region on the side there, on both sides. And the next thing that I want to do is check her bowel sounds while I've already got my stethoscope out. I want to listen to each quadrant, and I want to do this for up to a minute, and it could take even longer just to hear something in her belly. And I want to make sure that they're all active, or if they're not active, I need to assess and see if they're hypoactive or hyperactive. And I'm going to do this right above the umbilicus. Right above the umbilicus on both sides are the top two quadrants, and then below on both sides are the lower quadrants. The next thing that I want to do is I want to feel her head. I want to just rub my hands in a circular motion around her head, feeling for any bruising, scratches. I want to look for any bruising or scratches. Her head molded, or her molding, she has a round head, and I want to feel her anterior fontanelle and her posterior fontanelle. The anterior fontanelle is a diamond shape, and it's soft and squishy, and the posterior fontanelle is a little bit harder than her anterior fontanelle and just a little smaller. And they said we'll find that in a triangular shape for the most part. So the next thing that I want to do is make sure that I feel her suture lines. I want to check and make sure there's no overlaps or gapping or anything of that nature. And following this, I want to look at her face. I want to see for any milia, any stork bites, any strawberry marks, anything like that. And I also want to check her head again for bruising, scratches, and I need to know any of these findings in my documentation. Next thing I'm going to do in my head-to-toe assessment, I'm going to check her eyes. I want to break up the outer campus to the other outer campus of the other eye. I want to break this up into thirds. So one eye should be 1/3, the nose should be 1/3, and the other eye should be 1/3. And while I'm doing this, I want to do my ear assessment, make sure that her ears aren't low set. I want to look at the top of the ear over here to the outer campus just to make sure that there's a straight line, and you want to do this on both sides. So I want to also make sure that there's no epicanthal fold. If there's a baby of Asian descent, they will have an epicanthal fold. But other babies should not have this, and it can indicate Down syndrome. The next thing I want to do is check her recoil on her ears. I want to hold the top of her ear down for about 3 seconds, and when I let go, the ear should pop straight back up to her head. If this doesn't happen, then it's a sign of prematurity. The next thing I want to do is check the patency of her nose. So I'm going to cover one nostril and feel the airflow through the other nostril and vice versa. And again, document any abnormal findings during that assessment. The next thing I want to do is I'm going to check her mouth, so I'm going to put some gloves on. What I should feel immediately is her root towards my finger when I put my finger up to her lips, as if she thought it was a bottle or the nipple. She is a breastfed baby. So I'm putting my finger up here, and once she lets me inside, after she's maybe done the rooting, I want to feel her palate for any openness, gaps, sores, anything like that. Maybe it didn't close all the way, etc. So the next thing that I want to do after that is leave my finger for a couple of seconds just to see if she has a good sucking reflex and document that finding. Okay. The next thing that I want to do is I want to feel her neck for any masses or abnormalities. So I'm just going to palpate carefully. And I also want to check her clavicles, and I'm going to do this before I test her neck for range of motion. So I'm feeling her clavicles for any crushed or broken bones. And this is more common in large babies. So the next thing I want to do is turn the baby's neck to check range of motion, and this is kind of hard in this baby. So I'm just gonna, there. And she has good range of motion. The next thing that I want to check is I want to look over her entire body and check all of her skin. I want to make sure that everywhere she is warm and pink. Make sure that her limbs don't have any like cyanosis or any bruising from labor. So she feels warm. You want to check and make sure if she has a hat or gloves or socks on, that we can take those off, and make sure that you look in her diaper, even just underneath the lines, just to make sure that we don't miss anything. And I'm going to pick her up and look at her back, make sure there's nothing on there. And she doesn't have any extra, what we're looking for would be like the vernix or peeling of the skin, redness, any cyanosis, and I also want to check her skin turgor, and I can do that on her abdomen or on her thigh. So I'm just going to pinch for about 3 seconds, and this just tests for dehydration. I also want to, with the skin assessment, I need to keep her covered, but I want to check her for jaundice. So what I'm going to do is I'm going to blanch 4 areas, and I want to check the sclera of her eye for any yellowness. So when I blanch, I should blanch for just a second, and if I get any yellow return, it could be a sign of jaundice. So I want to blanch her forehead, blanch her chest, abdomen, inner thigh, and I want to look at the sclera of her eye. And she seems to be perfectly fine. So the next thing that I want to do is I want to talk about respiratory distress. I'm looking for signs of this every time I'm in with the baby, but I also want to teach mom these signs of what to do when she gets home and we're not around. The 5 signs that are most common, you may see seesaw respirations, which is when the chest and the abdomen are breathing on different patterns. You may see retraction breathing, which is indentations in the ribs. You may see grunting, apnea greater than 20 seconds, and you may see some grunting, which I think is about seesaw respirations, grunting, apnea, retractions, and then nasal flaring is the 5th one that I missed. So after that, what you want to do is you want to check the abdomen, and I want to make sure there's no distension or sunkenness, and we want to make sure that her belly is round. And I also want to palpate to see if I can feel any hardness or anywhere that is abnormal. So we want to make sure that it's soft and squishy. Next thing I want to do, I want to look at the cord. So I am going to clean her cord. And what I want to note here is if the baby is if her cord is still moist, drying, or dry. That's the assessment that we do. What I'm going to do is I'm noting, okay, it's still drying from labor yesterday, but it's not stopping moist, wet. So I'm going to hold it up and just clean with soap and water. Just for a little bit. And I just want to do cord care with every diaper change and every assessment. The next thing that I want to check for is her genitalia. I want to look for in this baby girl, and I'll show the male later. I want to make sure that her labia majora is covering her clitoris and her labia minora. The other thing I want to check for is any discharge, stool, or void. A little bit of blood is common, and what we will do if we do notice that, we'll just wipe that away, maybe get a wipe and clean that up, and we can note it in the charting. So she's clean. We don't need to perform a diaper change. The next thing I want to do is the muscle tone reflex. I want to take baby's arm, and I need to keep her covered up so that she doesn't get uncomfortable. I want to hold the baby's arm down, and then I want to bend it up to her head and hold it for about 3 seconds. And then I'm going to pull the baby's arm back down straight and let go. And when I let go, the baby should bring their arm back up as a reflex. And if they don't, it's a sign of prematurity. Next thing I want to do is I want to check out her hands. I want to make sure that she has palmar creases and 10 fingers. I also will note if there's only one palmar crease, it could be a sign of Down syndrome. Or prematurity if there's not a lot. I want to check the feet for creases on 2/3 of the foot, and I want to make sure that she has 10 toes. And I also want to do the Babinski reflex. So how we do this is we're going to use our fingernail just to line the outside of her foot here and go to the big toe into the little toe, and this will make her toes flare. This will tell me if her reflexes are working in her feet. Next thing I want to do is check her spine. So what I'm doing here is I'm just looking at the contour of her spine. I just want to make sure it's straight. And I also want to look at her coccyx area and make sure there's no tufts of skin or anything, or tufts of hair. And I want to make sure that there's no gap there. And I also want to make sure that she has a gluteal smile. And she does. The next thing I would note is I want to note her behavior during this assessment. So she's pretty sleepy, but she's not unconscious. It's nothing to be concerning. She aroused when I needed her to arise. And I would note that in the charting. And the next thing that I want to do is test her Moro reflexes. So what I can do with this is I can make a loud clapping noise or hit the table next to her, and this should make her kind of alert, like she will maybe kick her arms and legs. It's just a form of hearing the vibration through the table and reacting to that. So what I'm going to do is I'm going to hit the table. Okay, and she is alert. She threw her hands and stuff. There's a couple additional assessments that I need to do. I need to make sure or check to see when her last void or stool was, and I need to document if I found one during this assessment. I also need to check with mom or check the chart when she's due for her next feeding. So in doing this, I could really find out when her last feeding was to find out when her next one is. It's about every 2 hours with this young of baby. In the nursery, we will weigh the baby, and we want to do this naked, completely naked, unclothed, so that there's nothing mixing up, because ounces are so important with these young babies. The next thing I want to do is the baby boy. I just want to check his genitalia for assessment purposes. So the first thing that I would do with the baby boy is obviously change their diaper if they need it to be changed. I want to check and make sure that the testes are descended. So what I'm going to do is, well, I would put gloves on. Which I would put gloves on. And what I'm going to do is push down on the top of the testes and use my index finger and my thumb with my gloves and make sure that the testes are descended on both sides. And I also want to check and make sure, and if they have foreskin, I need to retract that, and make sure their meatus is on the top of their penis, the tip of their penis. And I also want to look at the rugae that they have, and the more rugae the better. The more rugae, the more mature that they are. That's all I have for my newborn assessment. Thank you for watching.